Welcome to this edition of COVID Ethics Update, a service of the Center for Practical Bioethics. Thanks for joining us today. I'm Cindy Leyland, and I work at the center. And today I'm talking with Dr. Gloria Thomas Anderson. Dr. Anderson is a member of the African American Advanced Care Planning and Palliative Care Network that is a part of our effort to increase the participation of African Americans in the advanced care planning process by working with faith communities. Today, she and I will talk about various tools that are available to help guide us in advanced care planning in general, and in particular, we will talk about tools that are tailored especially for the Black and Brown communities. First of all, Gloria, since we are friends, may I call you Gloria?
Absolutely, Cindy. Of course, you can call me Gloria.
Thank you. Thank you so much.
And this is probably a good time for me just to mention that one of the tools we'll be talking about is one that I personally developed, and it's being offered through my websites, of course. And I do have a financial interest in that, so I wanted to disclose that.
Thank you so very much.
You're welcome.
So, Gloria, one of the first things that we want to talk about is, what is it about the COVID pandemic that makes advanced care planning such an important topic?
Well, as you know, it's always been an important topic to those of us that's been working with this for a while. But I think the need is amplified now by what we're seeing all around us. The reality that death can be so immediate, even if you're healthy in the moment with this disease. And it has no respect to persons. This COVID-19 has no respect to persons. And if you're infected, there's no known cure just as of yet. So when we see this reality, not only in many of our families, but in our communities as a whole, and even in the whole world, I think people are starting to see the necessity for this and planning for life after now, and just making those steps to do what we do in our work and help that come to pass.
Absolutely. So let's talk about some of the tools that are available to the general public. Of course, the center is known for our Caring Conversations workbook, which promotes the conversation. We know the value of naming someone to speak for us when the time comes when we might not be able to speak for ourselves. Say we're in a car accident, we have a cardiac event, and we just cannot speak. But if we haven't had the conversation, how will the person who we've named to speak for us know what we want? If we want full court press and we haven't told our durable power of attorney, how are they going to know that? Or if we say we don't want CPR done and we haven't told them, they don't know that.
Right.
That's why we encourage the conversation, so that, caring conversation works for some people.
Yes.
But there is no one size fits all. We understand that. And other options include products offered by the Conversation Project. There's the Go Wish game, the Hello game, 5 Wishes, My Directives, Respecting Choices. There are so many tools out there. But the common denominator among all of them is you have to talk to somebody. You have to have a conversation. Talk about what it is that you want.
Yes.
And who wants to talk about death and dying? Nobody wants to talk about that.
No.
They're tough subjects.
Yes.
And in some cultures, that's a simply taboo subject.
Yes.
So Gloria, would you tell us about the African American culture? How might we approach this topic, and what tools might be helpful in this culture for having this conversation?
Well, first, I just want to disclaim African Americans are no different from any other culture when it comes to talking about death and dying. It's tough. It's tough to think about our own mortality, regardless of our cultural beliefs or values or backgrounds. But in terms of how we might approach this topic, I've found that a faith-based approach is really a very helpful one. going through the churches, because many African Americans, they trust their church. It's a trusted source within the community. It helps them in all areas of their life, not just healthcare decision-making at end of life, but all factors of societal life. And so according to the reason why I think that's important, Gallup poll did a survey not recently, and it was reflecting that about 85% of Blacks report religious and spiritual, that dimension of their lives is very important to their everyday lives. And so I believe that faith-based approach is an excellent way because of that institution of the church being such a trusted one. I did an informal survey in 2018 that 72 African American pastors and ministers participated in on this very issue. And almost 90% of them stated that they see a need in their congregations to provide a culturally relevant and easy to understand educational process to learn more about advanced care planning and end-of-life options. About 86% said that they don't currently offer any type of training, but they feel that their church has a responsibility to offer that type of education to their congregants. And 92%, which is one of the real reasons why I developed the program I did, was that they said when someone dies without letting their loved ones know what their wishes are, oftentimes, more often than not, there's a lot of conflict and confusion that happens with family members at a time when grief is in all of their hearts. Mm-hmm. And when I developed the in-house training program, that the Let's Talk About ACP, it's for pastors so that they can host their own workshops in their own church with as many times as they want, and with people who are interested in learning more about how to make these decisions and how to have these conversations. We've done 2 pilots so far, and they've received excellent evaluations, and the reflection of it also is that the participants are saying that afterwards in their post surveys that they are actually having the conversation. So that is really the end all for all of us who are working in this field. That's what we want to see. We want to see people have those conversations. I remember that lit review that we
absolutely.
It was by what's the doctor's name?
Dr. Ellen Eidler and Jenny McDonald, her
postgraduate
student. Yes.
Yes. Well, when that lit review showed us some best practices on advanced care planning and end-of-life tools for the African American community. And they also supported that need that the faith-based approach is a really good one for us to approach this and getting people to talk about this topic. They concluded in that research effort that there's a need also for innovative and culturally relevant resources being developed by the community itself, which I totally agree with, and that it's one of the ways to be more successful in getting that educational knowledge out to the public, especially in this community.
Absolutely.
So I'm really excited about that. I'm an African American, of course. I'm an educator and I'm a social worker, and I've been working in this for about 14 years now with you guys on many projects, which I'm really blessed to be a part of. But I've had that opportunity to take the booklet that I mentioned earlier from 2006, the first edition, and now in COVID-19, we've updated that, made it a little more conversational and also educational that people can use right now. So it's a 2020 special edition that has been created as an advanced care planning guide to guide this conversation and to give people a tool in hand that's culturally sensitive, that deals with the spiritual values, the cultural values, and the generational values, and the historical content as well. That's what we wanted to do. So that's now available. And
why don't I pulled up the cover and the website while you continue to talk about it, okay?
Oh, great, yes.
Yeah, let me pull up a photo of what it looks like.
Yes.
So there's the African American Spiritual and Ethical Guide to End-of-Life Care that you authored.
Yes. It's in the
Okay.
9th edition now, and what I'm really excited about with this edition, it provides an extensive resource directory of website links to some of those great tools you mentioned earlier, the Conversation Project. All of those are mentioned in there, and other helpful resources that can help families and caregivers, especially now during this pandemic situation that we're all facing.
And where can people find this document?
Right now, we are working to get it on most of the major networks of distribution, but you can go to my website. I have 2 websites, eolcareguide.org and then hearttones.com.
Thank you so much, first and foremost, for doing this work. It's very important work, and you have received, you're being very modest because I believe you've received some significant honors for doing this work, and we appreciate that. It's important work, and it needs to be done, and I am glad that you took the leap and did it. I have one more question for you. As you know, as we all know, a lot of the data that's coming out tells us that COVID-19 is affecting Black and Brown people at exceptionally high rates. And this is amplifying pre-existing social inequities that are tied to long-term institutional racism, class, and access to healthcare systems. Is there a role that advanced care planning can play in affecting this paradigm?
First, I must just acknowledge you're right. This is a serious, very serious time in our history. The alarming fact that many African Americans are dying from COVID in disproportionate numbers in the US is just one of the most grievous times in history for people of color. I just did an hour-long webinar with a hospice group this week, and it would take more time than we have in this few minutes to really talk about that more adequately, especially to address some of those deeper layers of why those disparities exist. But with that said, I will say that the role of advanced care planning has always been important to not only African Americans, but to every ethnic group, but especially for people of color who have experienced grave disparities, not only in healthcare, but in underlying institutional constructed systems of racism that's just throughout history. The role for ACP, though, in my opinion, is that I feel it's best that we approach this through trusted clinicians to help get that word out, to help in that planning, the role of advanced care planning in our communities by going through, trusted clinicians and doctors and community stakeholders and faith-based organizations, like I mentioned earlier, with our churches and those organizations associated with that. These are all on the front line, if you will, of the work. Truly, they are on the front line. Not only this is before the pandemic, but during the pandemic, and will be there after the pandemic. So I feel that the role of those different entities are very key in helping to advance advanced care planning education among this population.
Thank you. So Gloria, tell me, what has made you smile today?
One of the things that made me smile first, I wake up every morning and the first thing I do is I thank God for life because it's so not promised. And in the uncertainty that we are experiencing in the whole world, I am just grateful to wake up and have breath. And so I smile when I look out and I can see and I can feel and I can just move and have my being and recognizing that that is a gift every single day. So that makes me smile. That makes me smile that I'm here, that I'm able to do the things that I feel God has called me to do with my life. And I just, let that be peace for me in this time of unrest for so many. And so, yeah, that brings a smile to me.
Thank you. As always, Gloria, you are a great inspiration. I appreciate you so much. Thank you for this conversation.
Thank you, Cindy.
And thank you for joining this edition of COVID Ethics Update, a service of the Center for Practical Bioethics. If you have ideas, questions, comments, or suggestions for future editions, we ask that you email us at covid@practicalbioethics.org. Please subscribe to the Center's YouTube channel and sign up to receive COVID Ethics Update in your inbox at our website, practicalbioethics.org. Thanks so much for joining us. Stay safe and be well.